Granada, Nicaragua. A Mexican poet once said, "There's nothing sadder than being a blind man in Granada." And to anyone who has visited this serene, scenic town, it's easy to see why. Granada is a beautiful, well-preserved testament to the opulence of the old Spanish Empire. From the luminance of its cathedral to the pretty cobblestone streets, Granada is a delightful jewel full of history and romance. Yet, even as tourism continues to surge in this little Nicaraguan town, for many of the native residents of Granada and the surrounding areas, medical treatment for congenital maladies is hard to come by, being beyond the expertise of local physicians and beyond the economic realities of much of the population.
Almost 10 years ago, we started kind of a grassroots organization made up of anesthesiologists, surgeons of different specialties, nurses from the operating room, perioperative services, and translators, that we started doing these medical surgical mission trips here in Nicaragua, actually. We usually do 1 to 2 missions a year. We've been coming to Nicaragua, we've been to Ecuador, we've been to El Salvador.
The first thing which changes people's lives is they actually see somebody coming in and asking them a question, what is their problem? There is actually somebody asking them, what are they suffering from, what can we do to help them? That automatically changes their life at the very first instance, that somebody cares enough to come from somewhere else and ask them what can be done for them.
I have been going to third world countries for approximately 30 years and helped develop this program at Scottsdale Healthcare. A cleft lip and cleft palate is a cleft of facial processes that are forming from the nose down and the side of the cheek or face inward. This occurs some 6 weeks in utero, so it's a very early occurrence. The palate is about 4 weeks, a month later.
My name is Carla Patricia Cordova. I am from Leon. I am here for my baby's surgery. I am very grateful for the specialized team of doctors that are operating on my baby. I am very, very grateful because this is a blessing. I thank God and your team for coming here to make us this wonderful gift, because it is a gift what you guys are doing.
Cleft lips and palates are a real problem in the third world here, because a lot of times the patients don't have access to medical care, and it's amazing how old they are sometimes when we see them, or they may have been corrected by a medical brigade, but they have healing problems, or they need revisions like many cleft lips and palates do. And so what we're doing a lot of today is revising cleft lips and palates to give them a much more normal appearance. And I think we have a lot to offer with that, because we have new techniques and we have the experience doing this that just isn't available down here.
Well, cleft lip and cleft palate are major problems for people here in third world country, primarily because of the lack of access to care. They can't get those repaired, and they may go on to adulthood in some cases. We've seen patients just in the last couple of days, as young as 2 to 3 months, to as old as adult, with partially repaired or sometimes not repaired cleft palates and cleft lips. And so certainly the sooner that you can do the repair, usually the better the results, both in terms of scarring but also in terms of speech. Another problem, of course, is that even after the repair, folks down here are not getting perhaps the best therapy, speech therapy, and other issues. Maybe not even have access to antibiotics in case of ear infection. So there's a lot of other chronic problems that are not taken care of by groups that are coming down here and doing the repairs.
First of all, I want to thank this group of physicians who, in good faith, are visiting our city. For us, it is very important, given the economic conditions of our country, and especially Granada. We have a population of about 150,000 residents. As you can see, we depend solely on this hospital and a fairly small medical group for the needs and demands of the community. To these goodwill ambassadors, this group of physicians who come to our city and have given their professional services free of charge, We receive them with open arms, and we are grateful for what they are doing for our community.
In many ways, when you come down to a country like this, like Nicaragua, to do cleft lip and palate, you want to have some very good working relationships with the physicians here so that you can teach them, have them learn, have them see the procedures, and perhaps go ahead and do those procedures in the future.
Whenever you have two cultural groups working together, you must have good coordination. With this group, we've had that, and as such, there has been very good response from the community. Although we have different cultures, in what corresponds to medicine, the approach is the same, the idea is the same, and we achieve the same objectives. We are achieving excellent results, and hopefully this will recur in the future. Nicaragua is always with its arms wide open.
At the end of the week, after seeing 40 to 50 or maybe more patients, there is a sense of personal satisfaction as well as a sense of group satisfaction.
If you want to really put your training to the use it was imparted to you for, either as a surgeon or a medicine man, you definitely need to do one of these missions, because you may have trained in the best institutions, you may have learned the best techniques, but unless you put your qualification and degree to the use of people who need it, need your training and your skills the most, you will never value your training or your degree as much. So I will say to my colleagues, you have to come down to one of these missions, do one of them, and then go out and treat your own patients back in Scottsdale.
Well, it's a learning process, and also the gratification of helping these people that are otherwise not going to be able to be helped is very gratifying.
It's an opportunity to help people that really can't or don't have the capacity to be able to help themselves. Many of the patients that we've had here can't even afford a Tylenol or have the access. A lot of them have driven or taken buses or boats from very, very far away. So it is very fulfilling to be able to help those people achieve the goals of having their cleft lip palate repaired, or perhaps a scar, burns, some of the things that we've seen here corrected or improved.
Well, after living in Scottsdale and seeing people go to different spas and getting rejuvenated and cleansed out, I tried doing the same thing, going to spas, but it didn't give me the same rejuvenation. Once I came here, I felt that this was the best spiritual cleansing I could ever get. And ever since I'm hooked. When I come here, when I go back, I feel recharged. I feel like there actually is a purpose to my MD degree hanging on my office. And I feel this is where the true essence of medicine comes out.
We're the luckiest people in the world live in the country that we live in, and I've been particularly lucky, and so we owe it to mankind and humanity to do things like this. It's not a chore, it's enjoyable, and one thing to remember, you can never pay back, but you can always pay forward. And most of all, you as an individual get more out of this than you ever give to any of these patients.
For many in this peaceful little hamlet of Granada, Nicaragua, this week was much like the last. But for others who have endured years of discomfort and deformity, their lives will never be the same, thanks to the generosity of American surgeons like Dr. Aldo Guerra, Dr. Jim Burtz, and Dr. Bill Layton, and their tireless team of nurses, assistants, and the volunteer efforts of Medical Hands for Healing.